Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bower, the editor of GP Online. Today on the podcast I'm joined by our deputy editor Nick Bostock to talk about the latest news affecting general practice. Coming up, we're talking about the BMA ballot on collective action by GPs in England and discussing the case of a practice in Cambridge that has handed back its contract despite having high patient satisfaction scores, to explain why funding for general practice is now a critical issue. We're also talking about NHS England's pilots, which will look at how PCNs can develop new ways of working in general practice. And a bit later on, I'm speaking to GP and Green Party health spokesperson, Dr Pallavi Devulapalli, who is standing in this week's general election in South West Norfolk, a seat that's currently held by former Conservative Prime Minister Liz Truss. Our good news this week is about some inspiring GPs as we look at the winners of the RCGP's Inspire Awards. That's all to come on this episode of Talking General Practice. First up, the BMA ballot on collective action is now running, and we're going to come on to talk about what the ballot involves and what type of action that GPs might be asked to take from August shortly. But before that, we thought it was worth highlighting a story we ran on the website recently about a practice in Cambridge that's been forced to hand back its contract after struggling with underfunding, to explain the predicament many practices might currently be facing. We know that this year's GP contract has delivered just a 1.9% uplift to funding, although this could be increased later this year when the Doctors and Dentists Review Body makes its recommendation on funding increases. The BMA has warned previously that the contract will lead to an increase in practice closures, and Nick, this case that you've been writing about seems to show just that, doesn't it?
That's right. The BMA actually said earlier this year that it was aware of practices already handing back their contracts because of the 1.9% uplift for general practice in 2024-25. And this practice I've written about in Cambridge looks like it's one of them. But I think this particular case is a really powerful example of the state of general practice as a whole and the crisis facing the profession, and offers a real warning about the irreparable damage that's being done to GP services across the country. The reason I say that is because some people might assume that practices that close have found themselves in that position because in some way they're badly run, or they're unsustainably small, or because of some other peculiarity. But the decision of partners at this practice, the East Barnwell Health Centre in Cambridge, to hand back their contract seems to show that even really well-run, high-quality practices are absolutely at risk. One senior GP I spoke to about this case told me that if they were looking to define the type of practice they'd want their mum registered with, this is exactly the kind of practice that they'd want, that they'd be looking for. It's a successful training practice, which I'm told many of the GPs working in the area have come through. It's rated good by the CQC. It has among the highest patient satisfaction in the area and is in something like the top 10% for patient satisfaction nationally. It has 4 partners, around 8,000 patients, so it's roughly in line with the median practice size in England. And it led the COVID-19 vaccination campaign across its PCN during the pandemic. This is a practice where they prioritise continuity. The GPs have personal patient lists. But the GP crisis now runs so deep that even a practice like this just isn't safe. And at the start of June, the partners wrote to patients to tell them that they'd been forced to hand back their contract because they just couldn't make ends meet financially anymore.
So what exactly are the main financial pressures that the practice says have pushed them into this really difficult decision to hand back their contract?
So in the letter they wrote to patients to explain their decision, the practice partners said 3 main factors were to blame for the practice becoming unviable financially. 1, the below inflation uplift to this year's contract, which we mentioned, but they also pointed to inadequate local funding and to massive service charges that have been imposed on them by NHS Property Services, which owns their premises. So in terms of contract funding, this practice is affected in a couple of ways. Across the country, GP funding has been cut by 52% in real terms over the past 15 years, according to the BMA. So this practice has been affected by that, as all practices have. And the 1.9% uplift for the current financial year is another blow on top of that longer-term funding trend of income not keeping up with costs. Then East Barnwell Health Centre is also disadvantaged by another element of the contract because it serves a deprived population. You'd think that at a time when government, the NHS and ICBs often talk about wanting to reduce health inequalities, that a practice like this would be offered additional financial support if it needed it. But the current GP contract actually disadvantages practices serving deprived populations. So there's plenty of evidence that deprivation is a big driver of workload in general practice, but the Cahill formula that's used to weight practice funding distributes funding mostly on the basis of age. And that's because older patients are more likely to have long-term conditions, to consult the GP more and so on. But in deprived areas, people live with long-term conditions from an earlier age, so can have similar health needs to older people in more affluent areas. But the contract just doesn't factor this in properly. And then there's the issue with the premises charges. This is a long-running issue for general practice that's never been satisfactorily resolved despite legal challenges and so on. And East Barnwell is one of many practices affected. More than 1,000 GP practices across England operate from premises that belong to NHS Property Services, NHSPS. So NHSPS is a government-owned company set up to run NHS estates. And in 2016, it implemented a new charging policy that resulted in GP practices operating out of premises it owns, facing new service charges worth up to six-figure sums per year. So these were huge additional charges that practices have not received any extra funding to cover. And in East Barnwell's case, they come to a substantial five-figure amount each year. So they've managed to settle fees for some previous years and to negotiate some reductions, but they still face these fees going forward. And basically this factor, on top of underfunding through the contract and so on, have meant the practice has been struggling more and more to make ends meet. And over the past year or so, they've been losing staff because they're struggling to award pay rises. So staff have moved to other jobs locally. This ultimately is a really clear example of how the underfunding crisis in general practice is driving popular practices out of business. Without the long-term cuts to funding, perhaps this practice might just have been able to survive with the service charges imposed on it. But we've got to the point where a dedicated group of partners just had no choice but to throw in the towel.
This can't have been an easy decision for them, can it? I mean, what did the partners say to you about how they're feeling about all of this?
They're devastated. They had no desire whatsoever to hand back their contract. They say they've left no stone unturned in trying to find a financial solution. They've tried to negotiate for additional funding and so on, but they've hit a brick wall. For themselves, the partners said they felt traumatised by the experience of trying to keep their practice going and ultimately being unable to do so. They said they have no idea what they'll do next, and that they feel they need time to rehabilitate, that was their word, and that they feel bruised and battered by what they've been through. For patients, they said they feel really anxious about the future, because although another provider will come in, this group of partners who've spent years dedicating themselves to delivering a high standard of continuity-based general practice to this patient population that really needs them, won't be around to keep it going any longer.
We know that the ICB the Integrated Care Board has put the contract out to tender, and that also tells us quite a lot about the current state of what's going on in general practice, doesn't it? What has the ICB actually said in that tender?
Yeah, so we've written over recent years about GMS practice contracts being replaced with APMS contracts, and that's what's happening here. But the new provider the ICB is seeking to bring in to run East Barnwell will not only operate under an APMS contract, but it'll also be expected to trial what the ICB calls an innovative new model of care for general practice. And on top of that, having just rejected the existing partner's appeal for more money to keep the practice afloat, the ICB seems to be offering substantially more funding per patient for a new provider under this APMS deal. The LMC said this was basically a kick in the teeth for the current partners, and in many ways it's one for the profession as a whole. To give a bit of a background on contracts, to explain a bit of this, GMS contracts, which are the nationally negotiated form of GP practice contract that most practices operate under, are held by practices in perpetuity. So these contracts technically last forever as long as practices keep their succession plans going and keep bringing in new partners to replace partners who are retiring or leaving. They can also be held only by members of the so-called NHS family, so GPs, practice nurses, and some other types of healthcare staff. But APMS contracts, alternative provider medical services contracts, can be held by companies and they're time limited. The BMA describes APMS contracts as short-term commercial contracts and says that only the GMS contract, as well as PMS contracts, which are similar, enable the kind of continuity of care that general practice should provide by setting up a partnership on a permanent footing. East Barnwell currently operates under a GMS contract, but the offer put out to tender by the ICB proposes to replace it with a 7-year APMS contract, so it's time limited in that way. So that's part of a wider trend that GP leaders feel is damaging the general practice model. But we know that ICBs are currently working to set up pilots of new models of general practice based around using more additional role staff, potentially splitting up general practice care into different streams for different types of patients. So the offer for a new provider at East Barnwell is very much caught up in that element of what's going on with general practice too. So overall, I guess the summary is that this is a really popular, successful practice. It's been driven out of business by underfunding, and it's being replaced by a more commercial model in a way that GPs believe potentially endangers the continuity of care that exemplifies the best of general practice.
It's a really sad story, isn't it? Particularly given high levels of patient satisfaction, particularly given that they're actually running a practice with a lot of continuity, which actually most political parties seem to back this idea of getting more continuity, bringing back the family doctor, which we've heard several political parties say in the past couple of weeks. And it just seems so awful that this practice has not been able to continue. I mean, this is obviously only one element of the underfunding crisis in general practice. We've talked at length on previous episodes of the podcast about the impact underfunding has had on GP jobs and about GPs struggling to find work and even having to abandon general practice, with one GP applying to work in Tesco's and another one as an Uber driver. But there's been more news on that over the past couple of weeks showing the extent of the crisis. Firstly, the RCGP, the Royal College of GPs, put out details of a poll of 2,000 of its members, which showed that 6 in 10 GPs looking for jobs have struggled to find work in the past year. Among GP registrars looking for work, that figure increased to 72%, which is massive. And the BMA has also put out details of its own survey that showed that more than 4 in 5 locum GPs in England are unable to find work or are struggling to find enough work. That survey of around 1,800 locums found that 56% said they were not able to find enough work, and a shocking 28% said they couldn't find any work at all. 3 in 10 locum GPs said they were planning a change in career and said the lack of available shifts was forcing them to leave the NHS. So that's kind of the context about this underfunding, and all of that brings us on to the BMA ballot on collective action, which has launched. The BMA England GP committee team is currently undertaking a series of roadshows to explain what this will all mean. The ballot's open until the 29th of July and it's open for GP partners in England to vote in. Why is it just open to partners, Nick?
Partners are the GPs who hold practice contracts and who run practices. So decisions about actions that could be taken at a practice level, like closing lists, adopting new ways of working, or refusing certain types of work, are really only things that partners can do. So that's why this ballot involves partners only. The previous referendum on the contract for 2024-25, earlier this year by contrast, was open to all GPs. And as we've discussed, that found that more than 99% of GPs overall rejected the contract imposed on the profession with a sub-inflationary 1.9% uplift and so on. But the BMA also said at the time, I think, that 3/4 of GPs who took part in that referendum were themselves partners. So we know already that there's really strong feeling among partners that the contract's not good enough, not fit for purpose. And this ballot then is just to find out whether partners are willing to go to the next step, which is to take part in collective action to push back against that contract.
Yeah, so when the BMA is talking about collective action, what exactly does it mean? What sort of things will it be asking practices to do if the ballot is in favour of action?
The BMA published guidance as the ballot opened, setting out types of collective action that practices could be asked to take part in. Broadly, it's things like delaying signing up for parts of the PCN directed enhanced service, the part of or the sort of bolt-on to the GP contract that governs practices' participation in networks. It's also pausing or delaying data sharing with the wider NHS, implementing the BMA's safe working advice for general practice, and stopping doing bits of work that are outside practice contracts but that reduce work for other parts of the health service. Practices won't be told they have to take part in any specific actions if the ballot comes out in favour of collective action. They'll just have local discussions and decide what actions they're prepared to take. But crucially, none of these actions practices will be invited to take part in are things that would breach their contract. So that's why this ballot's non-statutory, and why the action that GPs could take will be very different from the all-out strikes that junior doctors and others have taken part in over recent months. Some of these actions are sort of technical, bureaucratic things like deferring signing declarations of completion for better digital telephony or simpler online requests until 2025. That's the kind of thing that might cause a headache for NHS officials at an ICB. There are things like switching off medicine optimisation software that ICBs want practices to use to save money. Also stopping rationing referrals or investigations, things that mean that practices are absorbing pressure that might bounce back now onto hospitals and other parts of the system. Refusing to use advice and guidance. The BMA said in roadshows that the number one action it wants practices to get ready for and to have discussions internally about how they might begin is implementing safe working advice. So that means limiting daily contacts per GP to 25. It means things like moving to 15-minute appointments as standard, as well as potentially things like setting up a waiting list for appointments and that kind of thing. So many practices have done this already, and GPs have actually described it as difficult at first, but ultimately life-changing for them and their patients because it makes their job feel doable again, limiting the number of contacts they have with patients, allowing a bit longer in appointments to talk through potentially not just one issue, but more than that, so offering a more holistic form of care. But it's clearly something that's a difficult ask at a time when practices are under absolutely relentless pressure to deliver more and more appointments with a GP workforce that's shrunk over the past decade or so.
Yeah, and has the BMA said anything about what happens if collective action doesn't make a difference? What if we don't see any major changes to how the GP contract is funded or any other concessions from the next government that really recognises the problems in general practice at the minute?
Yeah, so I mentioned that the collective action GPs could take part in would include only things that don't breach their contracts. But the BMA said that as a last resort, if negotiation or collective action don't make the next government deliver the kind of step change in funding the profession needs to end the GP crisis, then they could turn up the dial. BMA guidance on this says they hope the new government, whoever wins the general election, listens and that GPs aren't forced into further action. But if they don't listen, GPs could potentially move on to take action that would breach their contracts, potentially action short of strike or strike action. And the BMA says that action at this level could include salaried GPs, registrars and other practice staff, I suppose as part of a collective action by practices as a whole.
Thanks, Nick. Just a quick reminder, if you haven't already listened to it, our podcast last week was an interview with Labour's Shadow Health and Social Care Secretary, Wes Streeting, where he talks about Labour's plans for general practice. He also explains how he hopes to be able to avoid GPs taking collective action, which we've been talking about here, if Labour wins the general election. So obviously, it really does remain to be seen if a new Labour government will be able to do that in quite a short space of time, prevent GPs from taking some of those measures we've been talking about today. But if you've not already done so, do have a listen to that interview because if the polls are to be believed, he could well be the new Health and Social Care Secretary by the weekend. Moving on, we got some more information about pilots that NHS England is running to look at how PCNs can develop new ways of working to, and I quote, optimise the general practice model. So Nick, why are these pilots being set up and what are they going to look at?
In May, we found out that NHS England had approved plans for ICBs to work with a small number of PCNs to pilot these operational changes and improvements that would optimise the general practice operating model, as you just mentioned. A letter about these plans talked about using data to understand general practice better, testing operational changes, digital interventions to try and cope better with rising demand and complexity. I think at this point I should probably mention that most GPs would probably think that hiring some of the thousands of GPs who are struggling to find work might be your first choice as a potential solution. But anyway, the letter also talked about working out how to deliver the vision for general practice set out in a document published last year called the Fuller Stocktake. And this document has been the driving force behind some high-profile attempts to rework the way general practice is delivered, notably recently in North West London, where the ICB eventually backed down over plans to split up provision of GP services. Those plans would have seen same-day access to general practice split off effectively and delivered at scale across the area, and similar plans elsewhere have sparked protests from patients worried that they could spell the end of the family doctor. The BMA has said these pilots shouldn't go ahead and that NHS leaders really ought to concentrate on reversing underfunding of general practice rather than putting extra money into untested new models of care. But we got hold of a document that spells out an offer to PCNs to take part in pilots of this new operating model. And basically, it shows that networks will be offered seven-figure sums of money to get involved.
And what do we know about how they're going to work? What will the PCNs involved actually be doing? And do we have a sense of the types of networks that are likely to be involved with these pilots?
So PCNs are going to get a chunk of money just for taking part, a participation payment, but the bulk of extra money will be to pay for extra clinical capacity. It says in the document we got hold of that pilot areas will get about 10% extra funding to effectively accelerate them to the 2028-29 stage of the NHS long-term workforce plan. So to move them ahead of the current plan that expands numbers of GP training places and brings in more additional role staff to general practice. So at a time when the BMA and RCGP are warning about thousands of qualified GPs being unable to find work because practices can't afford to recruit them, these pilots are offering extra cash to boost clinical capacity, but only in the context of trialling a new care model. The document we got hold of says this will be a before and after study, collecting data at the start to measure demand, funding, costs, and then comparing how these areas look after they've taken part. And to be considered, PCNs will have to have a track record of collaborating with their local system partners, as well as to have done things like implementing the modern general practice approach that was part of NHS England's plan to improve access in primary care. So they have to be areas that are already on board with NHS plans for integration and with the direction of travel it sees general practice going in ultimately.
What's been the BMA reaction to all of this?
I mentioned that the BMA felt these pilots should be scrapped and that the NHS and government should focus on reversing long-term underfunding of general practice. But in a webinar recently, the BMA GP committee chair was really strong on her view on these pilots and on whether or not people should take part. She said that practices or PCNs that agree to take part, that accept extra money for trialling new models of general practice while other practices are closing, are effectively colluding in the demise of their own profession.
I'm delighted to be joined now by Dr Pallavi Devulapalli, who is a GP and Green Party councillor in Norfolk. She's standing as the Green Party candidate in the general election in South West Norfolk, a seat that's currently held by former Conservative Prime Minister Liz Truss. Pallavi is also the Green Party's health spokesperson. Thank you so much for coming on the podcast.
Thank you for having me, Emma. It's a pleasure.
I just wanted to talk to you a little bit about how you got interested in politics in the first thing. What was it that made you become interested in getting involved in politics?
Yeah, it was an indirect route. I was very environmentally conscious from a very young age. And then the whole reality of the climate crisis hit me about 18 years ago. And since then, I've been increasingly concerned and very frustrated at the complete silence from the top politicians, from people in power, from successive governments, actually, both Labour and Conservative. And I finally took the plunge last year and joined active politics and campaigned and became a Green councillor.
So you're a local councillor on your council. What does that role involve?
Well, essentially, I represent, it's like Parliament, but on a much smaller scale. I represent the people in my ward, which consists of about 7 parishes. But apart from that, I'm also on a couple of committees on the council. So I'm on the Environment and Communities panel, which is a scrutiny panel, but also one that puts forward policy for the council. I'm also a member of the planning committee. So we are the ultimate sort of decision-making body for all planning applications in West Norfolk.
From becoming quite interested in politics, and particularly from your point of view, being interested in green issues, it's quite a big leap going, right, I'm put myself out there and stand to be elected. What was it that made you really want to actually become a councillor in the first instance?
I started getting involved with local environmental issues. So, I got involved in a campaign against an incinerator locally. After years, 2 or 3 years of sustained campaigning, incredibly against all the odds, we won. And then I sort of campaigned to protect an area of special scientific interest locally from being developed and built over. And then another one was a woodland that was going to be removed to make way for a quarry. So these were all non-party political things, but it kind of made me realise that actually councils have a lot of power, that they do make decisions which affect people's lives in quite a dramatic way. So that kind of piqued my interest. And of course, national parliament is a much bigger piece of fish, to fry. Local councils I'm not saying they're easy to get into. I replaced a Conservative councillor, but certainly the scale of it is smaller. So it was a bit more doable. So it felt like a good first step into active politics.
Why did you decide to put yourself forward for the general election? Because obviously this isn't the first election you've stood in either. You stood in 2019 as well, is that right?
That's right. So 2019 was my very first sort of active foray, if you like, but I was much more of a passive candidate then. I wasn't very particularly clued up on anything, in terms of the way things work. This time, the election announcement came very, very suddenly. So we were definitely caught. I mean, I've been doing clinics all these 5 weeks, there's no chance of cancelling at such short notice. I'm a GP in my day job. So it's been very, very difficult. But I feel I'm ready to make that leap now. And I would love to get elected to Parliament. So I'm standing with a very serious intent to win. And I would very much like to be an MP because the scale of what I can do as an MP is obviously that much bigger. I'd be able to influence national policy and possibly internationally as well, which is where the effort needs to be, in my opinion. We need international collaboration and working with other countries to make the changes that we need.
You're a GP, that's your day job. You've been a GP for a long time. What does your experience as a GP bring to politics, do you think? How has being a GP helped you in terms of your political career?
I think it's helped me tremendously. For a start, it helps me have a pulse on what people are thinking and feeling. Obviously, I don't talk politics in my consulting room, but I know what concerns people have, whether it's the cost of living, their mental health problems, things that really, really frustrates them, the long waits to see a hospital doctor. And when you look at it properly, you realize that all of these are happening because politicians of the day have made certain decisions. So that has definitely informed me, very much so. So the other thing, of course, is your communication skills have got to be spot on as a GP. By doing the job, you learn to communicate quite difficult and sensitive topics, sort of in an understandable and palatable way to people. And I think these are all skills that are so tremendously useful for a politician. You have to have that ability to communicate with people and meet them where they are.
Do your patients know you're standing to be their local MP? I mean, what's the reaction been like for people who've come into the surgery?
Oh, absolutely, they do. Obviously we don't put anything up in the surgery, but, I have people come and wish me good luck. And some of them are just so thrilled that I'm standing. I've had very encouraging responses on the whole.
Just the campaigning or your work as a local councillor, have you learned anything from that you kind of find you bring into the surgery as well? Has it influenced the way you practice as a GP at all?
It has actually. It's made me realise that we actually need closer working with councils because councils do things. For example, there's a household support scheme that councils run. And if we could be more clued up about that, we could actually signpost our patients who need it to those schemes. The same with the home insulation scheme. So the council was doing a home insulation scheme where people with chronic diseases were getting financial help to actually insulate their homes, which is such a complete win-win, because obviously we know cold and drafty homes means your health is likely to be poorer, especially if you've got COPD, if you've got other health problems. So I think closer working and a better interaction with councils is a good thing.
When you're out campaigning and speaking to local people, what are they saying about the issues that they're concerned about? Is the NHS one of the big things that's coming up?
Absolutely. So lack of dentistry, especially in my area. So we have almost no NHS dentists, and that is really, really frustrating people. And people have been telling me their horrifying stories of waiting for months and months, having dental appointments cancelled at the last minute, their children going without checkups. One person told me how he pulled his own tooth out. It's awful, it really is. But then, of course, the main NHS as well, very often they tell me they can't get to see their GP. They're waiting months and months to see a hospital specialist. And of course, while they're doing this, their health is not where it should be. While they're waiting for months and months to get a shoulder replacement, they're unable to go to work, they're unable to care for their dependents, unable to play an active part in society. So it's having such a damaging effect on every aspect of our lives, of our communities, by not having the healthcare that they need. So for me, I think the NHS is a big part of this election. I really, truly believe this is the election of the NHS.
The manifesto, the Green Party manifesto, has some quite ambitious plans in there around health. And these are obviously things that anyone who's elected as a Green MP will be pushing for and campaigning for in Parliament. So you're talking about a really big increase in funding for the NHS and for a greater share of that funding to go into primary care. Does the Green Party and you yourself really think that more funding is really the only way to kind of solve some of the challenges facing the NHS?
That's a really good question. And my answer will be the funding is essential, but it's only the first step.
Right.
Put the funding in, make sure the staff are paid properly so that morale improves, retention improves, staff stop looking for other jobs to pay their bills and to make ends meet. Once you've done that, then I think we definitely need to look at the governance of it, look at accountability right across the NHS, look at this whole system to see what we can do to make it better, to really drive the changes that we need, to make it more responsive and accountable, which is where we need to get to. But we can't do that until we start with the funding. Funding's first and foremost. It's got to be in place. It's got to be the first step.
When it comes to general practice, obviously you're talking about more money, a greater share of funding going into general practice. What do you think needs to happen in general practice to improve the situation there? What would you like to see happen sort of soon after the election in general practice?
Well, the first thing is the Rs funding that we currently have, which is ring-fenced for non-doctors and non-nurses. That's got to go. Get rid of Rs altogether and give the funding to GP surgeries. By all means, tell them that they've got to use it to employ staff, that they can't put it in their profits, because that seems to be the big fear, that GPs just grab all the money and just get richer while services, don't improve. So definitely do something to make sure that you see a service improvement with that money, but give it to GPs and trust them. Some GP practices might need a pharmacist, others might need another GP, others might need practice nurses. Just trust them to make that decision because they know their population, they know their needs. And you can't just blanket ban them from employing doctors and nurses, which is where we are currently. But apart from that, I'd love to see money going to GP premises. We're crying out for better premises. My practice is a classic example. We're bursting at the seams. We've more than doubled in size in the 8 years that we've been in existence. And we have no rooms. We're hothousing like crazy, but we haven't got the deep pockets to actually invest in our own premises at the moment. So these are the things that I think, and the Green Party actually talks about that. We talk about $1.5 billion in general practice premises.
And the Greens are proposing that this should all be paid for by increasing taxes on the richest people.
Yeah, we're quite open about that. We're also talking about windfall taxes on banks, windfall tax on oil and gas companies. There's lots of money in the system. It's also about priorities. It's not as if the government isn't spending anything. They're spending lots of money, but just choosing to spend it on things that don't make sense, that don't benefit the population. So we would bring some common sense into the equation, I think.
One thing that's obviously central to the Green Party and its manifesto is about tackling the climate crisis. How do you see that linking in with health and your policies on health?
The whole beauty of all of our policies is everything's a win-win-win. So we have a huge focus on public health. And by public health, I mean things outside of what we traditionally think of public health. Of course, we'll, fund smoking cessation and alcohol help and drug rehab and all that sort of thing. But we will also invest in active travel. We will invest in public transport. And both of these things will not only improve physical fitness and mental health, they will also reduce loneliness. And all of these things have a direct impact on health. It'll enable people to actually attend GP appointments without needing to worry about getting a lift down. It will help them to get to hospital quickly and promptly, when they need to. And it will bring so many more people into the active social kind of system, if you like. And that's just one small example. We would also, for example, encourage healthy eating. So we would put the tax levers in such that healthy eating actually becomes cheaper and more affordable. We would incentivize local growers using various levers again in government. And these are all things which would benefit the growers, it would benefit the economy and benefit people by enable them to make those healthier choices. Time and again, studies have shown that when people are given the choice, they choose to eat healthy food. So the reason there's so much junk food being consumed, which in turn is leading to so many of our health problems, is because that's what they can reach for. So all of these things which have quite a dramatic impact. And actually, people think it takes years and decades for public health measures to translate into good health. And that's simply not true. We've seen the example in Scotland where the minimum alcohol unit pricing, it's resulted in a reduction in deaths related to alcohol within 2 years of bringing that about. And most of those reductions have come from people in the lower socioeconomic brackets. We've seen a reduction in teeth extractions in children since the sugar tax came in England on soft drinks. I mean, considering that was such a weak, watered-down sugar tax, and even that has had an impact so quickly, shows you the power of looking at the wider picture and putting those measures in much higher up the chain so that the ill health doesn't even happen in the first place.
People always talk about the climate crisis being a health crisis as well. Is that really a fundamental part of your view as well?
Oh, it's massively important. And I'm afraid we're seeing it already. Who ever heard of people dying of heat strokes? We are definitely going to see more erratic weather patterns. We're going to see a reduction in our food supply. Not just because of the wars, but climate change is already having an impact on the food that we're producing. So we definitely need to kind of grapple with this now and not 10 or 20 years down the line, because the longer we leave it, the harder it's going to be to mitigate and to take measures to stop the worst effects of it from affecting us in our day-to-day lives. It's much cheaper, much more efficient to take action now. We can still have a good life. We can still leave a habitable planet for our children. Or we need to act.
I mentioned earlier that you stood in the election in 2019 as well. So obviously you've got experience of 2 elections now. We're obviously in quite a different place than we were in 2019. Quite a lot has happened in the last 5 years, hasn't it? Have you noticed a change in voters and voters' attitudes between those 2 elections, the kind of things that people talk to you about when you're out and about?
Yeah, I'm noticing a lot of anger. Some of them are so angry that they can't bear to think of politics or politicians. They kind of put everyone in the same bracket and they've just given up. But the anger is so palpable. I live in a very staunchly conservative area where we've had conservative MPs for decades now. And for the first time, I'm hearing people say they will vote anyone but Conservative. And so many of them are not decided on who to vote for. There's not a huge affection for Labour either, where I live. So I think this is going to be a very interesting election.
What's it actually like on election night? I mean, do you have a sense about what time your results will come in? Do you have to go and stand in a village hall or a sports centre all night and wait for them to come in? How does that all work?
Yeah, no, that's exactly what happens. So I'm going to be there at 10 o'clock. The boxes will start arriving straight after. And they initially sort them out and then start counting. I'm expecting results. The election agents are telling me they're expecting results to be announced by about 5 a.m. in the morning. But because of Liz Truss, of course, this time interest is very, very high in South West Norfolk. So expecting a lot of journalists to attend on the night.
If you did get elected, would you still carry on doing a couple of days in general practice where you could here and there?
Yeah, that's exactly what I plan to do. I'd have to give up my partnership, but I would want to locum and keep my hand on the, it's just make sure that my skills are still up and that I'm still able to work as a GP because I love the job. And I think my patients would miss me. So yeah, I'd like to do that.
Would you recommend other GPs think about standing for a political position, be it like as a councillor or as an MP?
Yes, I would, but I would caution that it is extremely exhausting. So you're looking at, 60, 70-hour weeks as a routine if you want to do both jobs properly. So make sure you have a good team around you, have some support. I don't think it's great if you've got dependents where you need to spend a lot of time. I've got 2 boys, but they're relatively grown up. So, they still moan that they don't see enough of me, but I don't think they're too unhappy either. I think proceed with caution, but yes, it's very rewarding. And, I think most of us become doctors because we want to help people. And it's the same principle in council as well. And people actually appreciate that. You can really help reach out to a lot of people as a counsellor, and you get the same satisfaction on a different scale, in a different sphere of activity. And I love meeting people anyway, and I would think most GPs do. We are people, we like interacting. So I think it would come quite naturally here.
That's lovely. Thank you so much for your time, Pallavi.
Thank you, Emma. It's been lovely talking to you. Thank you.
Before we go, we've just got time for a very brief good news story, and this week it's about the Royal College of GPs Inspire Awards. The awards, which were presented earlier in June, recognise GPs and celebrate the work of RCGP members who do work that benefits patients, local health communities and GPs. There were some very worthy winners of this year's awards that were presented at the college's headquarters, and you can read more about all of the winners on our website. We'll put a link to that story in the notes for this episode. The awards included those for GPs who've done some really outstanding work on sustainability, equality, diversity and inclusion and education, as well as for GPs at different stages of their career who are making a real difference. The Lifetime Achievement Award went to Dr Shiv Pandey, who is now 85 and continues to do work for the RCGP and has had a 62-year career in medicine. He's worked in India, London and finally settled in the northwest of England, where he spent the last 30 years as a GP and where he's undertaken extensive work in his local community in Merseyside. Anyway, as I say, you can read more about the award winners on GP Online. Well, that's it for this week. Thanks for listening, and thanks to Nick and also to Pallavi for taking the time to talk with me this week. I'll be back next week. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice on our website. That includes our coverage of the general election, where you'll be able to find out how all of the GPs who are standing to be elected, including Pallavi, fared on Friday morning. You can find us at GPonline.com.